So good day everyone! In today's video, you will see how to do the perineal care procedure. So the objectives of these are, first, to be given as part of the bath but may also be done at other times if necessary. Second, to remove abnormal vaginal discharges to prevent infections and promote healing. It is used as prescribed treatment that is performed at specified intervals. And lastly, to prevent infection. It is usually done to postpartum mothers. And what we have here are the materials or equipment needed: waterproof pad, bed pad, irrigating solution, cherry balls, clean gloves, and sterile perineal pad. Now, let's begin to the procedure steps. In perineal care, you have to assess the perineum for swelling, redness, excoriation, and presence of odor. It is also right to assess the perineal discharges, like the color, amount, and odor of it. And at the end of the procedure, the client will be comfortable and the client's perineal area is free from any signs and symptoms of infection.
Good morning, ma'am. I am Julina Divilla, your student nurse for today from Medici de Makati College. So I am here to do the perineal care procedure. So may I just verify your identity? So you are Miss Rose Ann Manalo and your date of birth is on July 21, 2004. Am I right? Yes. Okay. So, to state the purpose of this procedure, I will be cleansing your private part to avoid any infection and also for me to assess if you have any swelling, redness, excoriation, and presence of odor, most especially if you have any perineal discharges. Is it alright with you, ma'am? Okay. Ma'am, I will be asking for your cooperation. So, to start the procedure, I will place you in a recumbent position with your knees flexed and separated in order for you to easily flex your hips. Okay, ma'am?
But before that, we have to provide privacy for our client. And after explaining the purpose and asking for the client's cooperation, wash hands prior to the procedure. And after that, assemble all the necessary equipments or materials. And now, here are the materials. And after that, place the waterproof pad under patient and place patient on a bedpan in dorsal recumbent position with knees flexed and separated, and drape the patient with perineal area exposed. And after applying clean gloves, separate the labia with non-dominant hand and pour warmed irrigating solution gently on the vulva from a sterile pitcher. And once the solution is being applied, cleanse the perineal area with cherry balls held in a sponge holder. Use a front to back direction and discard each sponge in a plastic or paper bag after one use. So after cleansing the perineal area, dry the perineal area using the dry cherry balls in same fashion, meaning using the inner to outer part technique. Now, apply sterile perineal pads. And after you apply the sterile perineal pads, do the aftercare. And after all the procedure, discard PPE appropriately and perform hand hygiene. And to report and document her findings, I haven't seen any swelling, redness, excoriation, presence of odor, and perineal discharges. And to evaluate the patient's comfort and treatment, everything is fine and there is no signs and symptoms of undesirable responses to treatment.